Many physicians' offices have consistently poor cash flow, collecting as little as 60% or less of what they charge. Even the best managed medical offices encounter collection problems from time to time. Consequently, physicians must implement a system of assessing the collection system to ensure that it is functioning properly. The best way to monitor the practice's collection efficiency is to implement metrics that tracks effectiveness at collecting charges. The following should be calculated: the net collection percentage and the collection period. The net collection percentage is a moving average computation that measures the office's ability to collect what it bills. It is advantageous to use a 12-month moving average to minimize the effect of unusual fluctuations in individual months. The formula for the collection rate is collections for the current month plus total collections for prior 11 months divided by net charges for the current month plus total net charges for prior 11 months. Medical practices should strive the collection percentages of 90% or higher based on net charges. Offices with net collection percentages of 80% or lower may be headed for trouble. Veterinarians and dentists, who usually require payment at time of service, tend to have high collection percentages. Physicians generally have lower collection percentages because they may not collect payment at the time of service and often have insurance claims disputed or rejected. The next metric to measure the effectiveness of your medical practice's collection system is the collection period. The collection period is the average number of days needed to collect professional fees. It is calculated as the average accounts receivable time 365 divided by annual billings. Ideally, only credit billings would be considered when performing the calculation. However, for most physicians, segregating credit billings from those paid at the time of service is impractical. Generally, the collection period ranges from 36 to 75 days for most practices. The actual collection period will vary based on the unique characteristic of each practice. Although a collection period of over 90 days is generally considered to be a sign of trouble, the physician should be more concerned if the collection period begins to trend upward.